Hey, I'm Jordan Snell. I'm a family medicine doctor here at Chehalis Family Medicine. I'm just finishing my 3rd year of residency.
My name is Erica Dennehy, and I'm a behavioral health specialist.
My name is Miguel Lee, and I am the program director for the St. Peter Family Medicine Chehalis Rural Training Program.
My name is Rain Lambrecht. I'm the Associate Program Director of the St. Peter Family Medicine Chehalis Rural Training Program.
Hi, my name is Janelle, and I'm a 2nd year pharmacy resident here at Providence Chehalis Family Medicine.
We're here once a week, and it varies by the day depending on what medicine service you're on in the hospital. And then occasionally you'll have what we call longitudinal weeks, where you spend a lot more focused time in the clinic outside of the hospital. And then as you progress to a 2nd year and then a 3rd year, you gradually spend more and more time generally in the clinic. And then we continue to do inpatient rotations at the hospital in Centralia. The question is, do I get continuity with prenatal care, then delivery, and then following the family thereafter? And yes, we do. It's one of the best things about being a family medicine doctor is getting to see patients all the way through a pregnancy. Then we immediately do the newborn care, and then we see subsequently these babies in our clinic. So it's kind of the ability to be the obstetrician, function as an obstetrician, and also as a pediatrician back to back, and then do postpartum care for moms too, which is something that many people aren't thinking about. But from a health standpoint, from a, getting them on appropriate vitamin supplementation, birth control if they want it, and making sure they're healthy and well after a pregnancy. So
Part of my role here is that I work every day directly with the medical residents. We also have a faculty pharmacist that is on staff. Unfortunately, I only get to be here with the medical residents for a year as part of my residency training, but it is a very, very rewarding experience, and actually one of the reasons why I chose to come here as a pharmacy resident, to have the opportunity to learn with, learn from, and teach the medical residents.
One of the benefits that I like about this model is we all take care of the patients. The clinic, we're fortunate enough to work in a clinic where there's an open flow model. So providers, residents stepping outside of the room, I'm able to hop into the visits with them. I'm available for curbside consults. One of the things that is great about working with residents is this huge desire to learn how to manage their own patients, but especially early on in their residency, they need help and guidance, and some of the patients, especially in rural communities, can be challenging. There can be a myriad of issues that they need help addressing, not just medical issues.
So working in this collaborative model of care that we have here at Providence Chehalis has been incredibly special. On one hand, it makes, I think, everyone's lives at work a little bit easier, between the doctors being able to care for their patients, and as pharmacists, both of us are always bouncing ideas off of each other. Each of us bring a little bit of expertise to the table, and that creates a really special mode of care for our patients. And then in that, I've also had patients come back to us as the pharmacists here, and also to the doctors, saying how much they appreciate having this holistic model of care for them.
One of the supports that I provide in the clinic is brief short-term counseling. We use a collaborative care model where I see patients anywhere between 2 to 6 or 7 visits. I consult weekly with a psychiatrist virtually, and I'm able to discuss the residents' patients with the psychiatrist. Sometimes they come into the visits as well and can consult with the psychiatrist. One of the benefits that I've heard from a number of residents having a behaviorist in the clinic is it's challenging to assess a patient in 10 minutes and prescribe a medication and not know if that's going to be effective for them. So oftentimes the residents will pull me into visits, or will schedule a patient to see me so that I can do a differential diagnosis to make sure that the patient has the correct diagnosis, so that we can have a better idea of what an appropriate medication will be for them.
The type of medical student that we're looking for, and the best fit for our program, is somebody who obviously has distinguished themselves academically, but beyond that, we are really looking for applicants who are focused on the mission. We really value social justice and equity in healthcare, and applicants who have demonstrated these aspects of the mission in their applications typically stand out for us. We also really value diversity and we value hard work. So people who have demonstrated across their education that they are hard workers and are mission-oriented are typically the ones that stand out in their applications for us.
We really value taking care of patients in a team-based approach in our patient-centered medical home in our continuity clinic. So it's really important that our residents really value everybody that's part of their team and involving them in the care of their patients.